Welcome to Social Work Live at the Columbia School of Social Work. My name is Michael Friedman. I teach health policy and mental health policy here at the school, and I'm happy to host this show every week. Each week we interview someone from the Columbia School of Social Work community to talk about the latest in social work practice, or today we're going to talk about social policy rather than practice, but I guess they overlap. And our guest today is John Robertson, who is a professor here, and does tremendous work on social policy and has been doing a lot of work to bring social work education online. Before I start the interview, I just want to point out that we welcome your questions. You can enter your questions onto the screen that you're looking at, and after 15 minutes or so, I'll look up and see if there are questions there. And if so, we'll begin to take them. So welcome, John.
So Happy New Year, Michael.
Oh, yes, that's right. Happy New Year to you, too.
The year of the pig, or the swine, depending on...
Oh, I see. Well, all right. It's a nice-looking pig. Speaking of pigs, what the hell is a MOOC?
What is a MOOC?
Yes.
It's Mass Open Online Course, and it's education on the internet. And so there are thousands and thousands of university courses up on the internet. And Columbia School of Social Work has just put its first one up, which is social policy, the basic social policy course that most students here have taken.
I thought that the Columbia was already doing online education. How is this different?
Well, the online education that the school has been offered is part of the degree program.
I see.
But this is free or relatively free education for the wider world. So people in India and in Kenya and people anywhere in the United States, anyone with an internet connection can take this course.
And it's free.
It's free if you just take the course. There's a certificate process, and if you want the certificate, it's $49 a course.
And the certificate could count for continuing education credits, for example?
Yeah, that, and many people use it to demonstrate to employers that they've done their work. So it has value for many people.
I see. And it's not very expensive to...
No, you can take the entire course for $250.
Wow.
Yeah.
So let's talk about the course. It's a course on social policy, and it's related somehow to social policy as it's taught here at Columbia.
And well, social policy is exactly the center of U.S. government activity. So about 2/3 of every tax dollar in America is spent on social policy.
2/3?
2/3. So it's a big part of our life. And that includes education, that includes healthcare, that includes income transfers and pensions, that includes social services. It's a big part of our national life. And so having people understand it, voters, and particularly practitioners understanding the structure of it as they work with people.
So let me just go back. You say that social policy is 2/3 of the federal budget.
State budget.
And state budgets.
Local budgets.
So it's all governmental budgets.
All government budgets.
And what's not in the 2/3?
Oh, highways, police, national defense, economic activity, investment, things having to do with inspection of spaceship, of all kinds of things.
So that's really interesting. What you're saying is that 2/3 of all governmental money spent in the United States is going essentially for one form of social welfare or another.
That's right.
And I think that would come as a surprise to most people.
Yeah, I think that why we spend so much time debating social policy, if you look at any newscast, there's a debate about one form or another of social policy. The money's big.
That's really interesting. I would bet that if we were talking to, I'm not even sure the average person on the street, because I've seen some of those interviews and they can be people who don't know who George Washington is. But for a person who really does know something about what's going on in the world today, I bet they would say that we spend more on defense than we spend on social welfare.
We spend more on hospitalization alone than we do on defense. We spend almost as much in Social Security. In fact, I think we spend more on Social Security than we do on defense.
Well,
Those are just parts of the
maybe
social
we'll come
welfare
back to those
expenditure.
numbers later on because they really are quite fascinating. I do think we should try to give a sense to the people who are watching what's included in this course on social policy. I know you have 5 sections of it. I'm not sure what the terminology is for.
So it's called a sequence, the whole thing, and there are 5 courses, they call it. The first course is in cross-national. It's comparing U.S. social policy to social policy of the major industrialized countries.
So
around the
that's
world.
really interesting. I think most people have the sense that the United States is pretty stingy in comparison to other countries in the developed world.
The only country that spends more than us is Norway.
So,
Every other country in the world spends less on social policy than we do.
so how come we're so misled about that?
Well, we spend it our way. Other countries spend it their way. A good deal of our money is spent through employer-based programs,
Right.
and a good deal of our money is spent on through tax-based programs. And a lot of it goes to people that are a little bit better off.
So that's interesting. So they could learn about this if they take the course,
Yeah,
right?
exactly.
Get
Yeah.
some much greater insight into it than we can do today. And what's the second part of the
The
sequence?
second part is where U.S. social policy came from. So from the time we began, the first Europeans arrived, and actually long before, the Mohawk had social policy programs
Oh,
as
that's
well.
interesting.
We've been developing our notions of social policy, and the idea of the worthy and unworthy poor has been a deep part of the debate for hundreds of years.
Well, I mean, do you start your course by talking about the Mohawks?
A little bit, yeah.
A little bit.
Yeah.
I was assuming you would have started with the Poor Laws and then how the Poor Laws traveled over here from
No, we
the
start.
Pilgrims and
We
so
start
forth.
by thinking about the settlement and agrarian villages. Yeah.
Oh, that's interesting. So one of the things that I'm very interested in the history of social policy is how there are constant changes in the social institutions that are responsible for helping people who need to have help. So the family is responsible, the houses of worship are responsible, charities are responsible, and then in this country today, there's this constant struggle that goes on between local, state, and federal government about who's responsible for what. So
Well, prior to industrialization, social policy was mostly family and institutions in the society, with a little bit of government role. After industrialization, and especially after the crash of 1896 and the crash of 1929, we shifted first to state and then to federal involvement. And so now all of those levels are involved. Families still deeply involved. Employers are deeply involved. There's lots of nonprofit sector, and then local, state, federal.
so take the course, and that's just course 2. Course
That's course
3 is
Course 3 explores the who of who we are in America. What do we look like in terms of families? How are we aging? What are the tensions? How have we marginalized people? How has white supremacy played a role in the development of social welfare?
so it's largely about demographics, I think.
Yeah, it's very much a demographics course. Because if you're going to spend that kind of money, you're spending it on a population. You have to understand the population issues to be able to understand how the money's spent.
Well, I might state it differently and say it'd be good if you understood the population issues before you spend the money. And I think it's fairly clear from the headlines that often policy is made without understanding these things.
But we spend a lot of money at every level with censuses and with surveys and developing knowledge about who we are.
And if there are big demographic changes going on in the United States today, I generally point to 2. I don't know what you think
Well, probably
ones are.
the biggest one is the aging society. It's definitely a really important part of it. And that is meaning that it's going to change the nature of the workforce. Automation's also a really important issue in how human society is being changed.
I would add to that the growth of the non-white population in the United States is important to understand for a variety of reasons, not the least of which is political. But that's just the third course.
And that the younger part of the population is non-white.
It's already a majority non-white in 2019.
This all has to do with our discussion about white supremacy. Where are we? Where are we going?
And, well, I could say more about that, but we'll let it go for
Another
the moment, another day. That was the third course. And the fourth course?
The fourth course is about the income transfer program. So the way in which we move money from one group of people to another, the family support programs like child care programs that we put in place, the support for poor people like food stamps and TANF, support for disabled people, SSI, SSD, and then the support for the aged.
Maybe we should just define some of those, at least in words. You mentioned the food stamp program, I think people understand.
Yeah.
It has a different name now.
Yep. SNAP.
SNAP.
Supplemental Nutrition Assistance.
All right,
Program.
so if people hear about SNAP, it's about food stamps. And then you mentioned TANF.
Temporary Assistance to Needy Families. It's the program that helps families that are in trouble. And it's a pretty small program, really.
It's become smaller and smaller over time, and it's a change from what used to be called Aid to Families with Dependent Children.
Yeah.
And different changes in that have to do with what the localities and the states and the federal government do as well. So TANF, and then you mentioned SSI.
Supplemental Security Income.
Supplemental
Security Income.
Right.
And that is the public aid, the welfare program for people that are disabled and for elderly people.
Replace the old disabled, aged, and blind program. But some disabled people are covered not by SSI, but by SSDI, you called it.
Social Security has two major parts. Right. One is the disability program, which has a lot of names, but Social Security disability. And the other is the old age insurance program, which we mostly call as Social Security.
We just call it Social Security. There's a lot to talk about there, and I'm sure you cover it in the course.
We push into all of that, yes.
And then the fifth one is?
Well, the fifth one really is about the major service programs. It starts with a look at education, and then it moves to thinking about health, and it looks at the major healthcare programs. Then it takes a look at education, at immigration, and finally there's an optional mode on child welfare.
Optional meaning?
Well, it's because it's a fifth unit in a 4-unit course, but we thought that there would be people that really wanted to know something about child welfare.
Well, I think it's great to have a fifth unit in a 4-unit course.
Yeah.
You know, why are we locked in by simple mathematics? So in this section of the course, you mentioned education first, and my understanding, I could be wrong, is that the funding for education in the United States comes largely from the local level, and that the federal government plays less of a role.
Right.
It's state and local, actually.
Yeah, it's state and local. It's about, the federal government provides about 7% of the education budget.
Little.
And the rest of it is split between local property taxes and state sales taxes.
And there are huge issues that come up about how much the locals are going to spend and how much the state's going to spend and how you equalize the distribution of funding for education.
Well, you can make an argument that we developed suburbs so that we could have distinct educational authorities and work ourselves out. It's one of the major issues in racial equality in the United States.
So this is also something that you talk about in the course. It's pretty clear that knowing something about all of this is important. Social workers certainly should know about it, and presumably every school offers a course in social policy of some kind.
Every social worker has taken some form of this course to get their MSW, but also police officers, teachers, people that work in hospitals, because when people walk into your presence, these programs, these structures are deeply affecting them. And so the idea here is to make available this kind of framing of what's going on across a broad professional base.
It strikes me that the MOOC might be helpful to social work students who are moving from the first year to the second year, for example, or even into PhD programs who don't remember terribly much
Right.
from the first course that they took in their first semester of
Well,
of
the school
study.
is working right now to create continuing education credits, because if you've been out for 5 years, probably a lot of this is pretty dim. But also, the other group of people who probably use it are people that are thinking about whether they want to go to social work school.
Right.
It gives them a chance to take a course, and the school Columbia will give you credit if you do the honors version of this course when you come in.
Now, in addition to people in our profession, as you mentioned, there are other people who could value from knowledge of social policy, and I also think about the voters of the United States, who are unfortunately few. I'll just throw in a little editorial there. I think we're in the process of giving away the American democracy because people don't vote. They have a right, and they don't take advantage of it. So it's that's my preaching for today. But they also ought to know something.
So Coursera, who's the company that hosts the most MOOC, is starting a whole health sequence. So their idea is that anybody who's working in health
Right.
needs this kind of knowledge. But there is a very strong opportunity for people that are voting to use this and other methods to get a sense of what the debate really is around them. And
Could be good for civic organizations to
the
connect with this.
The course heads to respect variety of points of view in America. I'm not doubting that as a social worker I have a point of view, but hopefully the course respects alternative points.
Well, that's good. That's good. As you know, I'm a social worker too, and we have different points of view.
Occasionally.
So there's even diversity among us social workers. We do have a question. I would like to hear more about how the course is taught online versus in the classroom.
Well, actually, I'm teaching this course in the classroom right now. I have a group of really wonderful students, and we get lots of exchange and debate. Online, there is a discussion board for people. So I also teach it online in our online master's program, both in a synchronous and asynchronous. Sometimes we're in a room together, and sometimes people are moving through it at their own speed. So I find that online education has the possibility of being quite rich, but generally people need to find some place to exchange their ideas, whether it's in a discussion forum or someplace.
So doing it in a discussion forum online works for people.
Yeah, I think so. I taught
Excuse me.
this as an asynchronous course the last 2 years, and there's a group of students that are much prefer being able to do this as an asynchronous course than as a synchronous course where they have to be in a classroom.
So it's like being able to use email to communicate instead of a telephone.
Yeah, it's, I guess.
Asynchronous means you don't have to both be in the same place at the same time, right?
Exactly,
Yeah, right.
yeah. And so every classroom is a synchronous course because we're all in the same room together.
So here we have a question from somebody who I think may be skeptical. You said U.S. spends more on social policy than any other country in the world. 2/3 of our government spending is for social policy, except for Norway. Is that spending figure per capita or total outlays, or both?
That's a great question. It is total outlays. We spend more than every other developed nation, but per capita, we're about in the middle. There are about half the nations of the world of the developed nations spend more per capita and about half less.
Okay. So that's very interesting. We don't have another question coming up now, but we had, as long as we're on the budget, we had talked before about the fact that we spend a lot more on the social welfare sort of parts of government spending, particularly if we include the private part of that spending, on, say, health than we do on defense. Are there other surprises in there about how we spend our money?
Well, there is this idea that Professor Dean Garfinkel has kind of introduced to this debate about the notion that there are safety net programs, programs for the very poor. There are floor programs, programs that everybody gets, like Social Security or public education. Everybody gets a seat in school. But then we have these platform programs where you have to have something to get them. And this is employer-based health care. It is more deductibility of your mortgage interest, which amounts to almost as much money as Medicare in the country. And that expenditure is quite surprising to people, that we're spending as much as we are to people that already are doing pretty well.
Maybe you can explain that quickly. There are sort of two budgets in the United States. We've got the visible spending, and then we have what Sherry Gleed recently referred to as invisible spending. And that's what you're talking about with the deductibility of mortgage interest, for example. Maybe you can comment on that.
In tax policy, we do lots of things to make people do this and not that. So after the Second World War, we thought everybody should buy their own home in a suburb, and particularly that white people should buy their own homes. We weren't so sure about other people buying their own homes. And so what we did is say that you don't have to pay taxes on the money you use to pay interest. So if you're paying, like I just found out I paid $18,000 in interest on my home last year, and if my tax rate is 25%, the federal government's given me about $4,000. Now, $4,000 is awfully close to what the federal government would give me if I was on TANF. And they've done that because they want people like me to buy homes. Now, that's a social policy decision.
And it's a form of spending that most people don't think about when they think about what is being spent and what isn't. We do have another question here. Do you ever have professors from other colleges take your classes online? I'm a social work professor and teach social policy in a state university and would love to know more about your courses. So how can they find out? How can he find she?
Certainly. Take a look at the MOOC. So you go to Coursera.org and then search John Robertson or something, and this MOOC will pop up and you get a sense of what it is we're doing. We have occasionally people drop in and sit through a class, or we might even invite you to come and talk in class and share some ideas with you. That would be fun, either online or in class. And these days with Zoom, you could be anywhere in the country and you could be in my classroom. And so that would be a really wonderful possibility.
So they ought to get in touch with you if they want to take advantage of that offer.
Continue the conversation.
They can find your email online
on the Columbia page. Yeah.
Right. Just look up faculty John Robertson, and you'll find his email. Yeah. I hope it was all right to say that.
Oh, it's true. And there is a need for us to keep talking to each other across disciplines and across institutions, because that's how we learn. Yeah.
Another question, can you say more about which health workers could benefit from the course, particular health careers or roles?
Well, if you go into a doctor's office or clinic, you spend a lot of time working on entitlements and how the which insurance company is going to pay for this, what's paid for. All of this is buried in the social policy discussion about how we pay for healthcare. So in today's New York Times, Utah and Montana, the citizens voted in the election in November to expand Medicaid to everybody up to 138% of poverty. Right now, the state legislatures are trying to push that back down, the Republican state legislatures. And so healthcare policy is deeply affected by these decisions. But the other thing is, where's the person living? Are they living in publicly supported housing? Is the person getting adequate nutrition? How is that nutrition being paid for? What's happening with the person's kids in school? All of these things affect the person who's walked in your office.
Well, I think that's very important to say. I think it's possible for a clinical social worker to sit in an office and somebody comes in and they talk about this and that, and the social worker doesn't have to know very much about social policy to do that, or so it seems. But as you're pointing out, if we're going to be doing social work, it's more than about what's going on in a person's unconscious.
But if you're an intake nurse, if you're an occupational therapist, if you're a primary care physician, these issues are walking into your office as well, and you're making decisions and providing service in the context of all of this. So I agree with you, Michael, about this is really vital for social work, but social work, not social work alone. I also think police officers need this. A teacher in a classroom needs this because of what they're seeing going on in their room.
I would just add to that for those people who are interested in rising in their profession, if you're a clinical social worker, for example, and you want to rise up into the administrative ranks, you'd better know this, right? Because if you can't answer the question, where's the money coming from to support this, and if you can't answer the questions about what the rules and regulations are for what we're doing, you can't do your job as an administrator. It's not enough to just complain that you don't get enough money and that the rules and regulations you don't like. You got to know it, and if you want to become an advocate about it, you have to really know it and get involved, which I would also.
Well, let me push that a little bit further. If you're a clinical social worker and you want to build your influence in your agency so that when you speak, it's really important that you understand what the whole context is. It's not enough to just know about the individual therapeutic needs, because people live in context and agency lives in context.
Another question, how do you suggest we respond to the new bill requesting that Medicare pay other professions to provide counseling services and other professions taking social work jobs? I'm not sure I fully understand the question. But
well, Michael, we are in various places in the country and nationally. There's a significant debate about which licenses allow you to do which.
So mental health counselors are now competitors of social workers.
California, the family, I forgot the term, but and so social work. If you're client-centered, what your concern is what's happening for the client. And are people adequately prepared and having a breadth of understanding to deliver the service to clients? And so if social work, if social work's making the case, which I think we can, that we have the context, the environment, the structure to understand what's going on with clients, then we make a case to be first on the list of reimbursement. I think, though, that in a pluralistic society, we're going to have to understand that there are other approaches at mental health counseling.
And I would add, this is one of the guild issues. Psychiatrists claim that only they can do certain things. Psychologists say, no, we can do some of the things that you can do. Social workers say we can do what psychologists do, and now we've got mental health counselors who claim they can do what everybody does. And the professions fight with each other to see who can get laws passed that will restrict what the other professions can do.
So when you're talking about state-level social policy, if you're in Albany or in Sacramento or in Springfield, Illinois, this is a fairly major conversation between this. But I would say to my students, I say this all the time in teaching the prop advocacy course, that the way you become really strong is by showing people what you can do. And social workers have enormous capacity to be really useful on teams. And good social workers start getting pulled into teams all the time. And so I'm less concerned about exactly the push and pull of this professional stuff. And I think that if we stay based in our client-centered work, which is what our code of ethics calls for, we will earn the kind of respect that will mean we'll be doing important work.
Well, I think that's a terrific sentiment. And having spent the past 40 years being a social work mental health lobbyist, I must say there are a lot of other considerations that go into the policy decisions that get made than just doing good work. And so I would urge anybody who's involved in our field who really wants to have an impact on politics, they've got to get involved in politics and they've got to get their hands dirty. But in addition to that, they've got to know what you're teaching. And if they don't know it, they're going to walk into people's offices and people are going to ask them questions they can't answer. They're going to be embarrassed by it and they're going to be written off of not knowing what they have to know. And their recommendations will be ignored. So they have to take your course is what I would say.
Thank you very much.
And I think we've run out of time, except it says we have a last question. So maybe we have a minute. I don't know. We have a minute. If we had a social policy lens, how would it change our experience of watching tonight's State of the Union address? What things would we be listening for?
Well, the first thing is you need to listen, and the second is listen for real proposals. So what is actually being proposed to change here and there? We'll be thinking about what's happening on the border, but the Trump administration is announcing today an expansion of services for the disabled in a certain way. And so it's listening for what is actually likely to happen in the change for people on the street. And that requires stepping out a bit of the political either pro or against and listen for what's actually likely to happen as a result.
Good advice. Thank you for tuning in today. Our guest has been John Robertson, who is enormously knowledgeable, knows a lot more than I do about social policy, and I do recommend taking the course. Next week we'll be back, and our guest will be Heidi Allen, who is a professor here at Columbia as well, who specializes in health policy, and we're going to be talking about Medicaid first. We may get to move on to a discussion of Medicare for All and the brawl that's taking place about that. And you could learn something about that too from the MOOC. So take John's course, and hopefully you'll be back next week, and we'll see you again.
Happy New Year, Michael.
Happy New Year, John.